Hi, I'm Tom Cosgrove, Chief Creative and Content Officer at earthday.org, and welcome to 22 Minutes with Dr. Mary B. Rice. Dr. Rice is the Director of the Center for Climate, Health, and the Global Environment at Harvard T.H. Chan School of Public Health. Dr. Rice's area of investigation focuses on the influence of environmental exposures, especially air pollution and climate change. Welcome to the show, Dr. Rice.
Thank you, Tom. It's a pleasure to be here today. And you can call me Mary.
Thank you, Mary. We're thrilled to have you. I've been looking forward to this conversation. There's so much we can dive into, but maybe I thought we could start with this. I'm sure, like you, we've all been following the traffic fires in LA and what's going on out there, and people are rightly worried about the impact of all that smoke and the chemicals from the buildings and other particulates in the air. How dangerous is that exposure, and kind of what's happening to our lungs in those conditions, and what are things people can do either in LA or similar situations, unfortunately, around the world, that kind of protect themselves from that type of more acute exposure?
Well, Tom, I'm so worried, as I think we all are, about the LA region and the people who are affected by these horrible wildfires. And wildfires are another form of combustion pollution.
Yeah.
And they're different in some ways in that it's not just wood that's burning, it's buildings, it's the chemicals in those buildings, industrial facilities, and that whole mixture, it gets suspended in the air and has been shown to be very unhealthy. Yeah. And especially for the lungs. There's been studies that have compared just by weight, particulate matter from background pollution versus particulate matter specifically from wildfires, and have found that it's 3 times more harmful for people with asthma compared to the particulate matter that we already know is really unhealthy.
Yeah.
And these exposure levels are just orders of magnitude higher than what people normally experience, and way off the charts in terms of air quality standards. And it's not just the people breathing in that dense smoke that you can see. Wildfire smoke really travels far, and as we've seen over the past couple of years, can really impair air quality in very distant places. So I'm very worried that we're going to see adverse health effects, especially respiratory health effects, even in distant places. So a very large portion of the population on the West Coast affected.
How long typically is that sort of, I'm sure it varies tremendously, but is that something where the sort of the worst of it is fairly immediate within weeks, or is it something that really we see effects lasting months and maybe even longer?
So, Tom, that's a really good question. I as a researcher, I'm interested in that question, specifically of the long-term consequences of especially repeated exposure to smoke, and especially for kids whose lungs are still developing.
Right.
And we don't have enough evidence of that yet. We can speculate based on what we know about particulate matter in general. That long-term exposure increases risk of death, increases risk of lung and heart disease. So there's the acute short-term couple of days around the wildfire events when, based on what we've seen in other research, I anticipate we're going to see a real spike in especially respiratory hospital admissions, but also cardiovascular disease and mortality.
Yeah.
And then the long-term consequences, unfortunately, I think are also not going to be good.
Harvard's T.H. Chan School of Public Health is one of the most prestigious institutions in the world. What makes it such a powerhouse in advancing public health, and how does your work fit into the bigger picture there?
Well, the Harvard Chan School in Boston works to improve health and equity through research, through education, and through engagement. And I was so excited to join Harvard Chan just a few months ago in October as an associate professor of environmental respiratory health and as director of Sea Change, is what we call the Center for Climate, Health, and the Global Environment. And this center has a long history. It was founded nearly 30 years ago. It was originally at Harvard Medical School. It was one of the first centers focused on climate and health at a medical school. And today our focus is on identifying solutions that protect health and to make our findings accessible and actionable for decision makers and the public. I would add that I'm also a practicing pulmonologist. I'm a lung doctor. I see patients. And a lot of my work over the last decade has focused specifically on combustion pollution and how we can better protect lung health in a changing climate.
Just to turn to sort of burning oil, gas, or fossil fuel use, essentially. It's obviously, well known as a huge driver of air pollution and something we know causes serious respiratory and cardiovascular diseases. But maybe we could just kind of break that down a bit and sort of what's happening on a physiological level when people are exposed to this kind of pollution. How does it actually make us sick?
Sure. Well, burning fossil fuels releases air pollutants that include really tiny invisible combustion particles that suspend in the air, and also gases like nitrogen oxides, and especially in the case of coal, a gas called sulfur dioxide. And these pollutants are inhaled deep into the lung, and that's where they cause problems. And there's decades of research, not just my own work. This spans a long time and includes different kinds of research studies, epidemiology studies, observing humans, animal studies, in vitro studies, and they've elucidated how these fossil fuel-derived particles and gases cause injury and inflammation. And it's not just in the lung, but it occurs systemically throughout the body because these inflammatory effects spill into the bloodstream. And that explains why there's such an extensive disease burden associated with these exposures. And I would really categorize this disease burden in two buckets. The first is that combustion pollution can cause acute medical events like asthma attacks, heart attacks, strokes, premature death. And the second category is about long-term exposure, cumulative exposure over time that includes exposure before birth, when moms are pregnant, their babies are affected. And this cumulative exposure can cause people to be less healthy, not just in terms of their lungs, but their immune systems are less resilient against infections like flu and COVID. They're more likely to develop over time chronic diseases that can last a lifetime, like asthma, heart disease, endocrine disorders like diabetes, and even the kidneys, because the kidneys are very much a vascular organ that the bloodstream goes through.
So it sounds like it's pervasive, but it's also a combination, if I'm hearing you right, of both chemicals that are ingested, but also the particulates themselves causing issues that start in the lungs and move on through the rest.
Spill over. Yeah. And the particulates just means particles. And so the composition of what that is really can vary. It can include carbonaceous particles, that are released when fossil fuels are burned, when biomass like forest is burned. It also includes metals. And there's even some evidence to show that the tinier the particles, the size of the particles might be one of the determinants of how damaging they are and how likely they are to cause inflammatory effects.
So given that, fossil fuel use is everywhere, it's, we're with our cars, the power plant, in your home, you name it, it's sort of around all of us. Are there, there's certain parts of the world or specific communities that we see much more disproportionately impacted by the use? And are there any safe zones, or is everyone basically at risk at this point in some way or another?
Well, absolutely, there are parts of the world that are more heavily impacted. I would also say that everyone is exposed to air pollution to some extent, right? We all breathe the outdoor air. You can't put your air in a bottle and clean it. And so there's impacts at a population level in all parts of the world. But globally, the regions in the world that experience the highest levels of combustion-related air pollution and also the highest estimates of the death rates from pollution are in Asia and Africa and the Middle East. So to give you some examples, the annual average fine particulate matter concentration, PM2.5, in Delhi, India was over 100 micrograms per cubic meter last year, compared to around 10 micrograms per cubic meter in the city of New York. So an order of magnitude difference, 10 times greater.
Wow.
And to compound that, many of the most polluted regions of the world also experience poverty and a lack of access to healthcare. And so that makes the health effects of that exposure even worse.
Right.
But everywhere, in the U.S., for example, which by that comparison is a less polluted part of the world, even in very wealthy areas, we do see really big differences in the impact of pollution, depending on where people live and where they work. People who work in working class jobs in industry and transportation are exposed at their workplace.
Yeah.
One group I would highlight that you may not think of as an industry job is people who are in transportation. Truck drivers, for example, have a higher risk of lung cancer because they're exposed to diesel pollution from the trucks.
Right.
And then a lot of my work has been around where people live, and people who live closer to sources of fossil fuel burning, and I'm talking about things like highways, bus depots, industrial facilities, power plants. The closer they are to those sources, the more heavily exposed they are. And then what we often see is those very same lower income communities that are hotspots for industry and pollution are disadvantaged in so many other ways, including healthcare. And so research has really shown that these big differences in combustion pollution exposure, specifically in poor neighborhoods, explains some of the really big differences we see in disease rates, like asthma by neighborhood.
When we think globally, sort of in the big picture around the health cost of burning fossil fuels from the perspective of air pollution and health, like what is that healthcare cost, and it feels, at least for some of the skeptics out there, it feels like it's not being talked about as much as other issues. I'm just curious, it's obviously massive impact in some of the things you described here and in other countries around the world. Doesn't seem like it's talked about as much. I'm just curious on your perspective on those.
Yeah, thank you, Tom. I talk about it all the time, and I think you're right that it's not talked about as much as it ought to be, given the magnitude of the effect sizes we're talking about here.
And the impact
I think part of it
throughout the rest of the body, as well, as you're saying too. It's not that the lungs itself wouldn't be bad enough, but as you say, it really then exacerbates so many other health issues, right?
So many health issues. Everyone is affected. There are so many analogies to tobacco smoking, which is also deadly, also affects developing babies and the heart and the lung and the brain. But I think it's more visible and obvious, right? You can see somebody smoking, whereas combustion pollution is for the most part invisible. But I can give you some examples here. According to the Health Effects Institute State of Global Air Report, which came out last year, indoor and outdoor air pollution taken together, which is primarily from the burning of fossil fuels, but it also includes biomass burning, that accounts for 1 in 8 deaths globally. And it's the second leading risk factor for death after hypertension, high blood pressure.
Wow.
And most of those deaths are from heart, lung, neurologic disease that are worsened by air pollution. And also in kids, and from that same report, air pollution was estimated to contribute to 700,000 deaths in kids under the age of 5. Again, putting air pollution in the second place after malnutrition for kids. We can think of it in terms of our life expectancy. So worldwide, air pollution shortens life expectancy by almost 2 years, 1 year and 8 months globally. And I'm not an economist. The dollar value of these health costs are enormous. But I think the air pollution point of view is really important, not just in terms of the doom and gloom and how bad it is, but also in terms of opportunity and the benefits that are to be gained when we move away from fossil fuels. You
touched on renewables a little bit as part of a solve for some of these issues potentially. Certainly, we know big environmental benefits. Have you come across any examples where adopting cleaner sources, wind, solar, et cetera, have made a noticeable difference in public health outcomes?
Mostly examples of when an emission source is shut down, or when traffic is restricted, for example. So to the extent that growth of renewable energy leads to displacement of fossil fuel-based industry, there are examples of benefits. So in the United States, we've seen really large-scale wind and solar installations across the U.S., especially in the South and the Midwest, in places like Texas and Florida, North Carolina, Kansas, Oklahoma. And so we're not yet at a point to estimate the benefits of those interventions. So I anticipate that we will see that. But we do know from other historical examples that when clean energy displaces fossil fuel combustion, air quality gets better. So I can give a couple of examples of that. A recent one, 2024, a study in Chile that examined the health benefits of solar power generation, found that new solar generation displaced coal and led to a reduction in hospital admissions for respiratory causes.
Right.
Now that's exactly what I would expect to see. In the U.S., there's an example of the Atlanta Olympics that's often cited in 1996, and then the city of Beijing during the Olympics in 2008 actually did the same thing, where they restricted traffic, and those interventions improved air quality right away.
Yeah.
And in association with that, asthma visits went down, and then went back up again.
Yeah.
And this, there was a whole series of studies in Beijing. So they also found a drop in cardiovascular mortality during the traffic restrictions in old people. And then healthy people without any disease, they actually had lower inflammation in the bloodstream.
Wow.
That then went back up again.
On a more individual level, are there things that individuals can do today to protect themselves from air pollution? Things like air purifiers, are they worth it? Are there other strategies we should, individually try to adopt?
Yes, there are things that people can do. And I actually encourage the listeners to check out the Sea Change website where we have guidance for patients and for clinics.
Right.
I'm a researcher, and one of my studies that's ongoing right now is looking specifically at air purifiers for people with chronic lung conditions. But what we do know is that air purifiers, HEPA filters, lower particle levels. We know that's true, and there are studies showing benefits for asthma. So if you can afford one, I encourage you, especially if you're in a place with high levels of air pollution, and as we mentioned, there are many such places in the world, to use those, especially on high pollution days. And there are ways that you can check the air quality right in your neighborhood. For the US, there's the airnow.gov website There are similar websites around the world, and so you can track when you have a poor air quality day, and especially if you have a pre-existing condition, a lung condition, a heart condition, pay attention to those poor air quality days. And I advise against going outside on extremely poor air quality days.
Right.
If you can. Use an air purifier. The most extreme thing, if you must go outdoors, for example, to get to work, and there's wildfire smoke or it's a very high pollution day, wear an N95.
Okay.
You know, if you're at risk.
Yeah.
Because that also that filters the particles.
Yeah. Well, finally, Earth Day 2025 is coming up, April 22nd. How are you marking the occasion, and any messages you hope to leave with people about the connection between the environment and public health?
Well, Tom, on April 17th, I'll be speaking at the Harvard Chan Studio event on climate, asthma, and allergies. And our center will be participating in other Earth Day activities at the school to really engage students in research and education around climate change and health. And I would end with a note that is just so important to prepare the next generation of leaders in healthcare and public health to deal with the health challenges of our dependence on fossil fuel. Because I really think keeping people safe, keeping people healthy is an integral part of this problem and the solution.
Well, we 100% agree with you, Mary, at earthday.org, and fully supportive of your amazing work. It's been a fantastic conversation. I really enjoyed it. I think our audience will as well. And thanks for spending 22 minutes with us.
Thank you, Tom.